The Immunization Plus and Malaria Progress by Accelerating Coverage and Transforming Services Impact Initiative, a World Bank-supported project through Edo State Primary Healthcare Development Agency, under the leadership of the Executive Secretary, Dr. Kosi Ohaimeri, has convened a local government interaction and engagement meeting with officers and head of the primary healthcare centers in Oredo Local Government Council. The meeting was designed to strengthen collaboration with the Impact Project team and local healthcare personnel in Oredo Local Government Council. According to the project manager, Dr. Idemudia Osayomere, the session was crucial for fostering coordination and building a reliable database that can help identify gaps and areas for improvement in health service delivery.
The project development objective, which is to reduce the number of women dying in our country and in our state, and the number of children less than 5 years dying, what we call under 5 mortality. And so that is the project development objective. And every other thing we are doing is how do we improve PAC service delivery in terms of quality and accessibility, so that our pregnant women and our children less than 5 years can have access to this. And we think that that will help us to reduce the number of them getting sick and getting treated, and then of course reduce the number of them dying. What you see us doing today is to take a deep dive into the data that we are reviewing for this Impact project. The Impact project is a World Bank supported project that the Edo State government is 100% behind, and this we are looking at the half-year review. Look, we've had a couple of weeks ago, we have our Q2 review meeting.
Representatives from the Oredo Local Government Council, including the Supervisor of Health and Environment, Honorable Monde Ubiegbe, and the Medical Officer of Health, Dr. Ehis Usiosefi, affirmed the Council's commitment to supporting initiatives that enhance public health. They noted that the engagement is part of a broader effort to improve maternal and child health outcomes within the local government area.
From the talk, we have also discovered that one of the things that is needed is mobility. I think the council will work around the clock to ensure that we also give them vehicle for mobility to enhance their performance. The primary purpose of government is to take care of our citizens, and health is one of the important things. So we take health very seriously, and we are 100% in support of this program.
I talk about ways to improve service delivery when it comes to maternal health, as well as under 5 health. It's cut across from immunization to deliveries. So what we did was that we took one local government, that's one primary healthcare center from the various wards, and they incorporated them into this system. So primarily there are 5 of them here, and their officers in charge as the head of the primary healthcare centers are also here, representing them as a body and also to partake in this very important interactive session.
The meeting also featured technical and practical sections, which participants described as impactful, offering valuable insight and tools for improving healthcare delivery.
This is Stakeholders meeting on impact. We want to appreciate the organizer. This program is really a helpful program in Oredo local government. Before, we have not focusing on some areas, in the key indicators in this program, under 5. But now, through this program, we'll be able to know the key indicators. We'll be able to prevent maternal and neonatal deaths among under 5 and pregnant women, even immunization. So we appreciate the organizer of this program. And we promise that henceforth, we are going to do better than what we have done before in Oredo.
There are some areas that we are not focusing on. This engagement will make us to know where to really focus on in order to prevent untimely death among under 5 and maternal death. So this project has really impacted us, just as the name impact, it has impacted us a lot. So we now know the next step to take. And because of this next step engagement we are doing now, it will help us to improve in our service delivery.
The Impact Project is part of a broader human capital development initiative aimed at strengthening health system and improving service delivery. In Benin City, Faith Dibia, reporting for Afrima Reporters TV.